So I had to fight for my diagnosis. Like many women with PCOS, I always knew something was wrong. I brought it up with several doctors throughout my life. I think my mom actually, when I was a teen, brought it up to a doctor at first, but typically with PCOS, it gets dismissed, or you're just put on birth control, or told to come back when you're trying to get pregnant later in life. It wasn't until I was 27, I was a patient with One Medical in New York, and I found a doctor who actually listened to me, listened to my symptoms, and she was like, yes, sounds like you have PCOS.
So PCOS is polycystic ovarian syndrome. It's a syndrome that women face in which they have an irregularity of their menstrual cycle, and they have what we call hyperandrogenism, which is either excessive hair growth, excessive acne, hair growth in places they don't want hair to grow. So that hyperandrogenism combined with those irregular menstrual cycles is really the hallmark of the diagnosis of polycystic ovarian syndrome, a syndrome in which the ovaries are there's a dysfunctional relationship with the ovaries and the metabolic system, and that is creating this condition.
And so I think I honestly first kind of heard about it through like celebrity culture. And then I started reading a lot, particularly on Reddit, about people that were using it for like kind of different conditions. And I kept seeing people having really good responses to Ozempic for PCOS. Honestly, just like reading on Reddit kind of led me to having conversations with doctors, which I think, again, like most were pretty dismissive.
I mean, PCOS is certainly a common, condition of women. I think we probably don't know to the exact degree because many people go undiagnosed unless they are kind of, a lot of people get diagnosed because they're seeking fertility, and a lot of these women have trouble with fertility. So that's, the first time when they might, acquire that diagnosis. So I think it's probably underreported a lot of times, and so we should probably do better, within our healthcare system in terms of asking the questions, making the diagnosis, so people can understand the disease better.
For me, the symptoms of PCOS were getting, unfortunately, worse as I was getting older. So my periods were becoming highly irregular. So I think throughout my life, I would have anywhere from like 5 to 8 periods a year. But as I got older, it was definitely trending more towards 5. And so my doctor listened to me. By the time I had this conversation with my doctor, Zepbound, tirzepatide was already out. And so I had asked for Ozempic, and she had actually said, I think Zepbound's going to work better for you. I'm seeing good success with tirzepatide and PCOS and less GI symptoms.
Are there benefits, medically speaking, from a standpoint of the medication itself or the GLP-1 activation in terms of changing the course of the disease of PCOS, independent of the weight or independent of the weight loss factor? That's the knowledge we don't have today.
I don't have any problems injecting myself. I usually do it on my stomach. And within about 3 months, my periods became regular again. And so it was pretty quick. I have never had regular periods in my life, but for the past year and a half, I've had really consistent cycles. I started Zepbound at like what is considered a normal BMI at 23. I did lose some weight, although by no means as drastic as other people who are taking it for obesity. But yeah, I lost about 20 pounds, and and now my periods are regular. So I don't, like right now, today, don't really have the symptoms of PCOS, even though it is a lifelong, genetic condition. I'm currently asymptomatic.
So we have seen anecdotally, at least, an increase in people's fertility relative to the weight loss associated with the GLP-1 medications. Now, whether or not there is any kind of also, we know from these medications, so other studies of GLP-1 medications and just, theoretical ways GLP-1 works, that it also works in an anti-inflammatory or inflammation, pattern. So whether maybe potentially there's some direct effect on the ovary as it relates to this inflammation and the cystic nature, I think is yet to be determined, right? Are we actually affecting the actual condition, the actual PCOS condition, or are we affecting some of the other variables within it? And I think that's where we need much more research in this area to understand that as it relates to this disease.
But because women's health is kind of, not prioritized, it's often seen more as a fertility issue. So PCOS is only an issue when you're trying to get pregnant, or, it's kind of like pigeonholed as that. And so I think a lot of the drug companies are reluctant to do testing on women on what is like kind of considered a fertility condition, because no one wants to put pregnant women in drug trials. And that's kind of just a framing issue, because this is a lifelong disorder, right? Like whether or not I have kids, I will have PCOS. So I really wish I had these drugs when I was a teenager. And I wish that I hadn't, honestly, like wasted so many years trying to kind of figure out things that didn't work. It is why I like to speak about PCOS and GLP-1s. I do think they represent the future of how this condition is treated. And to me, it is worthwhile if, 11-year-old girl, a 12-year-old girl who thinks something might be wrong, she can kind of immediately find a solution rather than waiting many years. This condition is like not good to leave untreated. It can lead to diabetes, it can lead to heart conditions later in life. And so if you can nip it in the bud, nip it in the bud. So I pay around $300 a month for the vials. And yeah, like my insurance doesn't cover it. It doesn't look like it's gonna cover it for honestly several years. And so that is like a big financial burden. I think a lot of people go after like compounded forms of tirapatide or the compounded version of semaglutide. And I think most of the compounded sources are pretty legit, but it doesn't feel great as a consumer to have to go that route when there are kind of more, safer, proven pharmaceutical routes. So like, I sometimes I'm like, I want to switch to a compounded version because it's like $100 a month versus $300. But I don't want to have to worry about safety when I'm injecting medication into my body.